Hello juniors, so I welcome you all again in the continued series of upper limb and thorax, and today we are going to cover an important topic which is the mediastinum. So in today's module we will be covering its introduction, classification, how mediastinum is classified into superior and inferior mediastinum. Then inferior mediastinum is further divided into three more types. We will cover that, boundaries and contents. So without wasting any further time, let's move ahead. So starting with its introduction. So the word mediastinum is derived from Latin, which means intermediate. So mediastinum means intermediate. So this is our lung. These are two lungs, and the space in between the two medial surface of the lungs corresponds to mediastinum. So mediastinum is the space between the lungs, and the most important organ which sits in the mediastinum between the lungs is our heart. So the most important content of mediastinum is heart. So now before jumping to the classification of mediastinum, I want you to recognize these two diagrams. This one is the schematic diagram and this one is the diagram taken from my 3D anatomy app. So this is the sagittal section of mid thorax, and here you are able to view the sternum and the vertebrates. This is our anterior side, this is our posterior side. For your better visualization and orientation, this is also the same section but in a more realistic way. This is the sagittal section, these are the vertebral column, this is the vertebral column, this is the sternum, manubrae of sternum, and this is a sternum. So now coming to the classification, which is mediastinum is divided into superior mediastinum and inferior mediastinum. So firstly, this is a sternum, manubrae of sternum, manubrae sternal joint, and this is our rest of the sternum. So the space between the two lungs is called mediastinum. So this space is divided into two parts, the upper mediastinum, which is called superior mediastinum, and the lower mediastinum, which is called the inferior mediastinum. Now let's see how they are classified, how they are divided into, how this space is divided into two different spaces. Now this dotted line corresponds to our thoracic inlet. What is thoracic inlet? So you can appreciate this when the pair of first ribs connects to the vertebral column. They form a inlet-like structure like this. This is our sternum. These are the vertebral columns, and this act as an inlet. So start. So the upper boundary of superior mediastinum is our thoracic inlet, and lower boundary of our superior mediastinum corresponds to an imaginary line joining sternal joint and lower border of fourth thoracic vertebrae. This is here the sternal joint, which an imaginary line with joining fourth thoracic vertebrae. So this space corresponds to our superior mediastinum, and the space below superior mediastinum is our inferior mediastinum. So coming to the superior mediastinum, the superior mediastinum is separated from inferior mediastinum by an imaginary line joining sternal angle to fourth thoracic vertebra. As I've already told you, this is that imaginary line which is joining sternal joint and fourth thoracic vertebrae. Now boundaries of superior mediastinum. Anteriorly, it is by manubrium sterni. So what is manubrium sterni? So this, for your orientation, this is our sternum. and this part is our manubrium and rest is sternum. So anteriorly by manubrium sterni, posteriorly by upper four thoracic vertebrae, superiorly by plane of thoracic inlet, and inferiorly by line joining sternal angle to fourth thoracic vertebrae. That one imaginary line which I was saying you. On each side I have mediastinal pleura. So what is a pleura? So by the way of review, pleura is a thin layer of tissue that covers the lungs and lines of the chest cavity. I'll show you this pleura in a few slides. Now coming to the contents. So for contents of superior mediastinum, I have taken this diagram. This is a coronal section of chest and you are able to view the heart, these two lungs, these are both lungs, and the space between the lungs is our mediastinum. So the space between the lungs, as I have told you, is divided into two. This is our superior mediastinum and rest is our inferior mediastinum. Once again, this is our superior mediastinum and rest is our inferior mediastinum. So the contents which falls in superior mediastinum are listed here. So starting with one by one, firstly I have phrenic nerve. So this is my phrenic nerve. Phrenic nerves, this one is my phrenic nerve which is accompanied with pericardiophonic artery and vein. Secondly I have vagus nerve. This is vagus nerve. Vagus nerve is the 10th cranial nerve. This vagus nerve also gives a laryngeal nerve, recurrent laryngeal nerve. So this one is our recurrent laryngeal nerve and the vagus nerve which is the parent of recurrent laryngeal nerve. I have a thoracic duct. So this green colored duct is a thoracic duct. So what is a thoracic duct? It is the largest lymphatics in our body. For review of thoracic duct, I have already made a video. You can just check out that. Left recurrent laryngeal nerve, as I've told you, left recurrent laryngeal nerve, which is a branch of vagus nerve. So why here only left recurrent? Why not right? So the right recurrent laryngeal nerve, which is also the branch of vagus nerve, it turns upward from here. It do not comes downward like the left recurrent laryngeal nerve. While descending, it turns upward from this level itself. So, right recurrent laryngeal nerve is not included in our contents of superior mediastinum. Nextly, I have brachiocephalic vein. These are my brachiocephalic vein. These two are my brachiocephalic vein. Nextly, I have aortic arch and three branches. So, I'll show you this in a minute. And next, I have thymus. This is our thymus. So, the thymus is partly in superior mediastinum and partly in inferior mediastinum. Next, we have trachea. This one is our trachea. This cartilaginous ring shows that it's a trachea. Next, we have lymph node. There are various lymph nodes present in this region. And lastly, I have esophagus. Esophagus sits behind the trachea. So anytime trachea is taken in contents, esophagus will by default be there. Now to show you aortic arch and its three branches, so I have removed the thymus from here. Now these are my aortic arch and these are the three branches of aortic arch. If you haven't seen my video on aortic arch, do check it out. As I was telling you, these are my brachiocephalic veins. The way I used to remember the contents of superior mediastinum is, please visit library before any test to learn everything. So the initial of each word of this mnemonic represents the content of our superior mediastinum. So P stands for phrenic nerve, V vagus nerve, L for left recurrent. Please visit the library. My bad. Please visit the library. T stands for thoracic duct, L stands for left recurrent laryngeal nerve, B stands for brachiocephalic veins, A aortic arch, T thymus, T trachea, L lymph node, and E for esophagus. So this is the way I used to remember the contents of superior mediastinum. If you can make your own mnemonic, it's way far better, but this way I found it simple to learn. Now coming to the inferior mediastinum. So here we are once again. So this was our superior mediastinum, and rest all is our inferior mediastinum. So inferior mediastinum lies in between superior mediastinum and diaphragm. This is our diaphragm. It lies between superior mediastinum and diaphragm. Inferior mediastinum is further divided into anterior, middle, and posterior mediastinum. So this is our anterior mediastinum, middle mediastinum, and posterior mediastinum. These all are divisions of inferior mediastinum. Now we'll be covering these three one by one. The anterior mediastinum. So this is our anterior mediastinum. This green colored space is our anterior mediastinum. So anterior mediastinum boundaries. Anteriorly by body of sternum, posteriorly by pericardium, superiorly by imaginary line separating the superior and inferior mediastinum, inferior by diagram, and on each side I have mediastinal pleura. So I'll tell you this. I'll make you explain with the help of this diagram. So this is the diagram of axial section. I'll show you where you are right now. So this person, I have taken the axial section and we are viewing from here, from downwards. So your point of view is, if a person is lying in supine position, you are at its toes and you are viewing this axial section. So this one is our anterior side, this one is our posterior, this is right, and this is left. So this is our heart. This one is our heart, these two are lungs, and the space between the lungs is our mediastinum. So what is our anterior mediastinum? This is our anterior mediastinum, which is lying in front of middle mediastinum. So this space is our anterior mediastinum. This space is our anterior mediastinum. Its anterior boundary is our sternum. This one is our sternum bone. Posteriorly, its boundary is pericardium of heart. What is pericardium? It's a protective covering of the heart. And superiorly, it's an imaginary line. This one is the imaginary line superiorly, and inferiorly I have the diaphragm. The medial. Now coming to the middle mediastinum. Inferiorly, it is from diaphragm, and on each side is the mediastinal pleura. So showing you the mediastinal pleura, this is our lung, this is the lung tissue, and this layer, this outer layer is our pleura. So on each side of the mediastinum is bounded by mediastinal pleura. So done with the boundaries of anterior mediastinum. Now coming to the contents of anterior mediastinum. So firstly, sternopericardial ligament. Showing you what is this. So these green colored bands are my sternopericardial ligament. As the name suggests, sterno, that means its one attachment is sternum. Pericardial, its one attachment is pericardium, and these are ligaments which joins the sternum and pericardium, and they help in providing the support and integrity to the heart. Secondly, are lymph node with the lymphatics. There are numerous lymph nodes in the thorax cavity. So these lymph nodes are one of the contents of anterior mediastinum. Lower part of thymus. As I have already told you, the lower part of thymus, here was my thymus, and the upper part of thymus was in superior mediastinum, and the lower part of thymus falls in inferior mediastinum. Areolar tissue. So this is my yellow colored tissue is our areolar tissue. It provides cushioning to the heart. And lastly, I have mediastinal branch of internal thoracic artery. So these are my internal thoracic artery, and they gives branch medially, and these are mediastinal branch of internal thoracic artery. Now coming to the middle mediastinum, starting with its boundaries, it's anteriorly by sternopericardial ligament. As I have already told you, this is my sternopericardial ligament, and this space is our middle mediastinum, anterior by sternopericardial ligament. So posteriorly, its boundaries are esophagus, descending aorta, and azygos vein. So once again, with the help of this diagram, showing you. So this was our superior mediastinum. Rest was our inferior mediastinum, and anterior mediastinum, which is the classification of inferior mediastinum, is lying in front of the heart. But now in this image you are able to view the heart, so this whole picture shows the middle mediastinum. So posteriorly we have esophagus, descending aorta, and azygos vein. So this is our trachea, but trachea bifurcates at this level, but the esophagus, which is behind the trachea, it goes till the stomach. Secondly, we have descending aorta. This is the ascending aorta, and behind the heart we have descending aorta. Descending aorta is also forms the posterior boundary of middle mediastinum. And lastly, we have azygos vein. So azygos vein is the connection between superior vena cava and inferior vena cava. I have already made a video on azygos vein. You can just check it out. And lastly, on each side we have mediastinal pleura. As I've already told you, so this is the heart. The heart sits in middle mediastinum of inferior mediastinum, and on either side we have the mediastinal pleura. So the contents, as I've already told you, heart sits in middle mediastinum. Arteries, we have ascending aorta, pulmonary trunk, and two pulmonary arteries. Rubbing it for you, I have ascending aorta. This is my ascending aorta, which comes in middle mediastinum. This is my pulmonary trunk and two pulmonary arteries. Pulmonary trunk gives two pulmonary arteries, which is not depicted in this diagram. So now coming to the veins, I have superior vena cava. This is my superior vena cava. Azygos vein, as I've already told you, azygos vein, I've made a video on azygos vein. And right and left pulmonary vein. So here is my pulmonary vein. This is right pulmonary vein and left one is right here, left pulmonary vein. In the nerves we have phrenic nerve and cardiac plexus. So this is my phrenic nerve. It is descending till the middle mediastinum and cardiac plexus. So what is cardiac? The cardiac plexus is in between the arch of aorta and pulmonary trunk, right here. And lastly, I have the lymph nodes. So done with middle mediastinum. Now, lastly, we are going to cover the posterior mediastinum. Going back to the diagram, this is our middle mediastinum and this one is posterior mediastinum. So posterior mediastinum, its anterior boundary is by pericardium and this is the upper part of diaphragm. Posterior boundary is lower 8 thoracic vertebrae. Inferior boundary is lower part of diaphragm and superior boundary is by that imaginary line. So anteriorly by pericardium, bifurcation of trachea and posterior part of upper diaphragm. So with the help of this diagram we will be covering once again. This is the once again sagittal section. Now this one is our heart and I have zoomed it in. So these are my vertebral column and the heart sits in middle mediastinum. So everything which is posterior to heart will form the boundaries and contents of posterior mediastinum. So this one is our heart. So behind heart is the bifurcation of trachea which forms the anterior boundary of posterior mediastinum and the pericardium of heart which also forms the anterior boundary of middle mediastinum, and lastly I have upper part, posterior part of upper diaphragm. So this is upper diaphragm and its posterior part forms the anterior boundary. Posteriorly by lower 8 thoracic vertebrae, already told you these are lower 8 thoracic vertebrae. On each side once again we have mediastinal pleura. With the help of this diagram, this posterior mediastinum on each side has a boundary of mediastinal pleura. Now lastly coming to its contents. Now coming to the contents, the first one is our esophagus. So the tube right behind the trachea is our esophagus. It is joining into the stomach. So as you can appreciate, it is lying posterior to the heart. So it's a content of posterior mediastinum. Secondly, I have arteries which is descending aorta. So this is ascending aorta. This one is descending aorta. Third, I have azygos vein, hemiazygos vein, accessory hemiazygos vein. Showing you the picture of it. This one is our accessory hemiazygos vein. This is hemiazygos vein and they both forms the azygos vein. I've already made a video on azygos vein. So anytime you can check it out. And lastly, I have vagus nerve and splanchnic nerve. So this nerve is our splanchnic nerve, and already told you the vagus nerve. So done with the contents of posterior, middle, anterior and superior mediastinum. Done with introduction, classification, boundaries and contents. If you found this video helpful, do like it, do share it with your friends. Thank you.